Welcome to this presentation about our evaluation in terms of service user and carer satisfaction with the advanced practitioner role. I'm here to speak about it, but I'm happy to say that Karen Greenback, who was the actual advanced nurse practitioner who was evaluated, whose performance was evaluated, will be available on the 21st of September. Objectives of the presentation are to give you a background to the service and context of the study, consider the aims and objectives, the methodology we used, present the findings, importantly of course, discuss the implications and what does this mean for the future in terms of the advanced nurse practitioner both within the memory service and in mental health services in general. Although late off the probably off the line, mental health nurses are now recognised that we work at an advanced practice level. And the advanced practice role has expanded rapidly in the last 20 years, and they're known to exist in a wide range of practice settings, obviously including the memory service that we're talking about today. However, there's little evidence in the research literature that details the overall contribution of the advanced nurse practitioner in mental health towards the health and social care outcomes. So, and when we did a search of the literature, we couldn't find anything that addressed whether or not advanced practice nurses met standards, for example, the 4 pillars of practice for advanced practice as set out by the RCN. From reviewing the literature, certainly about the memory service context, we found that colleagues in Tasmania who had several studies and produced several papers, actually came up with the overall theme that nurses in such advanced roles are well received, in particular regarding engagement with time given to people diagnosed with dementia and their families. Mirroring the national and international context, the memory service team that you can read there had challenges, and thus it was seen both within Kirklees, Huddersfield and Dewsbury, as well as the South West Yorkshire Foundation Trust as a whole, that the new ANP role could target what these challenges were positively to meet the clinic, the demands. And then there's just a little bit further down there for you to read about the fact that ANPs within the memory service are now actually becoming embedded, they're being recognised. So looking at aims and objectives, this study aimed to undertake a survey evaluation to assess service user and carer satisfaction, what they felt about the service. We used the 4 pillars, as you've seen in the previous slide. The evaluation was conducted over an 8-month period in 2018 using a cross-sectional questionnaire which had certain items which were Likert 1 to 5 response and some open-ended items as well. The data collection was, we'll let you know, over an 8-month period. The purposeful sample was really the people that Karen worked with, and with the questionnaire sent out to 115 service users who attended the memory clinic over that time, and of course their accompanying families or carers over that time. We found that 85 respondents completed the questionnaire, so there was a good rate, a 73.9% rate. The benchmark, which is now accepted for advanced level nursing practice, has 4 pillars, 4 areas. There's clinical and direct practice, leadership and collaborative practice, improving quality and developing practice, and developing self and others. And this is where our evaluation concentrated. This slide shows you the 15 items that were related to the 4 pillars of advanced practice level of advanced practice level nursing. If you want to look at the individual items, please stop and just have a, you'll be able to have a good look at the individual items. Overall, it states that there was a high satisfaction of that 73.9% sample response. The one if you like, outlier where there was a lower score was I've received a copy of my medical care plan. Well, the medical care plan may well have actually been sent after the respondents had actually responded to the survey evaluation. So it was a question of timing. But again, overall, if you look at the 4 pillars, clinical direct practice, leadership and collaborative practice, improving the quality and developing practice, and developing self and others, that was perceived by the service user and probably the respondents and the people who responded would be carers, family members. It's a high satisfaction with the performance of Karen. We also undertook a deductive content analysis of the open-ended comments that went alongside the 15 items, the response questions. And you can see from both clinical direct practice, from leadership and collaborative practice, improving quality, and the developing self and others, it showed there were some reassuringly positive comments that showed the value, the respect, and the satisfaction that the service users and carers had with the advanced nurse practitioner role within the memory service, and of course undertaken by Karen. Really hope that you'll be available to come on the 21st at 6 p.m, 21st of September at 6 p.m, to actually discuss the implications of this study. But in essence, they clearly show that the service user and carer were highly satisfied in all aspects of the 4 pillars of the questions that was put to them. The survey was undertaken early in the development of the advanced nurse practitioner role, and the memory service has expanded since then. So we've got plans to continue and review the ANP aspect of the service, both within the memory service and in the wider roles of advanced nurse practice within the trust that goes across, of course, the lifespan and different contexts, different specialities as needed. We've established that the questionnaire used in the survey had good levels of face validity and internal reliability, but we will be considering its construct validity before any future implementation. So at the present time, the ANP successfully runs assessment and diagnostic clinics within the memory service, and we can't suggest that this is got total replication to other contexts within the UK, but it does show that the time wondering whether an ANP in a memory service can diagnose has ended. They can work as an advanced practice, autonomous, skilled nurse who provides care as competent and as good as our medical colleagues, a psychiatrist who would be involved in the memory service. And we believe that means that this will be able to both be replicated elsewhere, both within South West Yorkshire Mental Health Trust, Foundation Mental Health Trust, as well as other contexts within the UK. And it will have resonance internationally as well. So we've obviously established that the ANP role, and now at least one's been evaluated, and it shows that the advanced nurse practice nurse role, certainly within the memory service, is becoming embedded. It needs to be further established, and ANPs are starting, they can show that they can undertake clinical interventions as safe, as competent, as I said before, as psychiatrists, for example. A suggested positive outcome for service users of the ANP involvement is the supportive and equal working relationship, and certainly that was found from previous studies conducted in Australia. An obvious one. Further high quality research is needed to establish the effectiveness of ANPs within the memory and mental health services generally, and research reporting outcomes of both service users and carers is necessary. One caution here is that we believe that it was the carer, probably mostly the family member, who will have completed the questionnaire. What we also need is the voice of the service user themselves. So finally, thank you very much for listening to the presentation. And this last slide just shows you that there will be a published article about this service evaluation, which will be published in the British Journal of Nursing in the not too distant future. Thank you.